How's that? Okay, disclaimer, no financial interest. I do have 2 books, one's on diving science and one's on wound care. Do get royalties from that. Objectives, I want you to appreciate the distinction between chronological and physiological aging and learn how different organ systems and body functions change as one gets older. Recognize the 3 factors that determine whether or not a scuba diver should continue to dive as he or she ages, and when to call it quits regarding diving with respect to age. Now, these are some of the terms you might see or hear as I progress with the talk, such as aging, infirmity, antiquated, senescence, etc. A few considerations. Our society is getting older. In 1935, when the Social Security Act was enacted, the average age of death was 65 years. Then 1 in 23 workers who paid into Social Security collected benefits. Today, 1 in 3 workers collect benefits, which is sort of a dim future, I think, for people younger than I am with respect to Social Security. 1/3 to 1/2 of the medical surgical treatments now available did not exist in 1965. So we're getting older, our society is aging. Now we have to define what old is. There's the chronological age and the physiological age, and they're not always the same. If you look at chronological age, that accumulates with years, but that does not consider fitness, co-morbidities, cognitive function, mobility, and insight. Physiological age is a functional and or health status almost similar to what would be expected in someone of a different chronological age. It's highly subjective. I know when I do my history and physical on patients, usually the first statement in the exam is the patient appears younger than his/her stated age, or conversely, the patient appears older than his/her stated age. The major considerations, with physiological age are health status, fitness, and cognitive function, and these, what I term the apparent age. Now, how to judge physiological age? We can look at activities. Can they handle activities of daily living, sports, work, social activities, cognitive function and creative abilities, and then recuperative abilities, really important. Almost all of us in a dive have had one experience or another where we've had some injury, a sprain or a strain. How do we respond to illnesses, injuries, surgeries, sleep deprivation, prolonged periods of inactivity. I like to use a score when I evaluate my wound patients called the function score, and what I do is look at 5 assessments: activities of daily living, ambulation, comorbidity, smoking, and steroid use, neurological deficits. And I grade from 2 for each of these to 0, and 0 is worst, 2 is best. And I can come up with a score of 8 to 10 points as a healthy patient, one that I feel very comfortable doing a history and physical and surgery on the patient without having a family medicine, primary care physician help me with that aspect of the workup. Anyway, if you generate 8 to 10 points, this would indicate a healthy patient and one that there probably would be no restrictions on diving. If it's 4 to 7 points, this is impaired and possible diving, but you have to make very definite considerations in the diving. And 0 to 3 points, this is a decompensated type of patient and no diving at all. Now, there are functional changes with aging. There's musculoskeletal system changes, and we can't go through all 32 of these, but there's decreased speed, endurance, and strength in muscles. And I'm noticing that now. When I climb a ladder onto a boat, it's very difficult, and mobility, if that first rung of the ladder is right at the water level, it's really hard for me to hyperflex my hips enough to get in that first rung of the ladder. There's cardiovascular and pulmonary. This is why Olympic athletes are in the younger, less than 30 age group. As you get older, your functions decrease. There's nervous system organ changes. One is vision, of course, where we become farsighted. There's endocrine and metabolic changes, decreased tolerance to cold, for example. Miscellaneous changes, for example, at the bottom there, decreased sexual performance. So if we look at these functional changes with ages, there's one that possibly improves for older age divers, and that's improved judgment and reasoning ability. And there are 32 that, or 97%, they deteriorate. And you have to weigh your judgment against those other 32 factors that may deteriorate to come up with a good answer. So what's the criteria for diving? I think there are three that have to be considered for any older age diver. They're fitness, co-morbidities. Remember, I use the term apparent age, so co-morbidities take in consideration health status and cognitive function and mobility and strength. Now, fitness, the definition is readiness, ability, especially cardiovascular and respiratory, to perform tasks requiring increased expenditure of energy. For example, extrication from a diving emergency. Now, standards for diving. None exist for the recreational scuba diver. Bovee said that divers should be able to do 13 minutes of metabolic equivalence of exertion on a treadmill test. That means you would be able to run a mile in probably 7.5 minutes or so. And I think very few, unless you're really exceptional, are able to do this, especially as you get older. Now, a nice study done by Dan showed that 7 to 8 minutes is adequate for non-emergency diving activities. So if you can avoid non-emergencies, you don't need those 13 minutes that Bovee recommended. For practical considerations, pair the diving activity with the level of fitness anticipated to be necessary to safely do it. Pre-dive planning and dive site selection are practical considerations. And there are high and low energy demands, fitness requirements for diving. And high demands are ocean with currents, drop and pickup type of dives, repetitive dives greater than 60 feet, et cetera, et cetera. Low energy and fitness requirements are lagoon, atoll diving, anchored boat with a buoyed descending line. Most dives less than 45 feet, good visibility, warm water. We all heard these last night from Dan Orr. Now, high energy fitness is the example. We were diving off the Mexico, 200 miles from shore, and this was a very difficult diving. The ocean currents were 2 to 3 knots. We had to drop and pick off of inflatable boats. The visibility was less than 40 feet, often swells with white caps, repetitive 70 to 90 foot seawater dives, and the water was cold. And this is what I mean by a challenging dive, and probably one that shouldn't be entertained if one is not fit. I just came back from the Galapagos about a year ago, and that was probably the most tough diving that I've ever done. 3 different currents intersect in the Galapagos. One is the Humboldt current from Antarctica, so it brings in very cold water, even though the Galapagos is on the equator. And when these 3 currents intersect, and we dove right in the intersection, as like an egg beater. And there was no way to maintain your depth at any depth, unless you're below about 60 feet. To try to do 1 foot ascent every 2 seconds was impossible, and it was ridiculous to think that you could stay at 10 feet for 3 minutes to try to wash off your nitrogen. There were no descending lines in the boats. The boats were free swimming, and they picked you up, and it was lucky that you could get picked up in those currents. Anyway, that's just an example. So fitness recommendations. The older divers should select activities commensurate with levels of fitness. How can you determine levels of fitness? Well, there's a little test I like to do. Probably the deepest dive you should do is the distance you can swim underwater on a single breath hold. So if you can swim 25 yards underwater on a single breath, that would be a deep dive to say 75 feet. If you can do 20 yards, that would be a dive to 60 feet. Now, that's just my own rule. You should be able to swim a distance with fins comfortably 100 yards in 2 minutes. And again, arbitrary, but it's at least a criteria, and I haven't seen any better criteria in the literature. Number 2, fitness of dives should be based on physiological age and ability to do sustained aerobic activities. Number 3, the older divers should assiduously adhere to diving safety. Now, comorbidities, these are other medical conditions that will coexist with a primary condition. For our purposes, the primary condition is older age, that is older than 50. And there are standards for diving. but there is no general agreement as to what medical conditions constitute absolute, temporary, relative, and no contraindications for scuba diving. For example, absolute would be a pneumothorax, a non-traumatic pneumothorax. A temporary situation would be, say, acute blood loss anemia from trauma where the patient is transfused and brings his blood level back up and recuperates from that. Relative contraindications would be something like asthma, and then there would be no contraindication to scuba diving, and giving credit to Carolyn Fife, breast implant surgery, for example, would be a no contraindication to scuba diving. Okay, practical considerations for comorbidities. Medical comorbidities that impose absolute or temporary limitations of scuba divers are independent of age. However, the older the diver, the more likely contraindications to continue recreational scuba diving will develop or be coexisting, such as cardiac arrhythmias, diabetes, etc. Okay, third and finally, mobility and strength have to be considered. Mobility in diving applies the ability to move from one place to another and to move joints through a functional range of motion sufficient to don and doff swimming gear, swim and enter and exit water. I find it increasingly difficult to put on a tight-fitting wetsuit. And I said, boy, this might be the end point for my scuba diving days. And then I got a little bit reassured because the world-class competitive swimmers were putting on these bodysuits to improve their swimming performance, and they would take at least 30 minutes of time to put on a thin bodysuit to improve their swim performance. So I said maybe taking my 5 minutes to put on the wetsuit isn't so terrible after all. Now, strength with respect to scuba diving is a matter of being able to lift diving equipment, carry the equipment to the water entry site, and make safe entries to the water and exit the water into a watercraft. Standards for diving, mobility and strength are the most poorly defined domain of the 3 age-related considerations. Many of the age-related changes have mobility strength ramifications, but only in the most extreme ramifications are they mentioned as a contraindication to diving. Of the 3 domains, the mobility and strength is probably the most important and the one that will make a diver want to stop diving. With experience, medications, and controlling the diving environment, fitness and comorbidities can be mitigated. When mobility and strength considerations become significant, the older diver self-imposes termination of diving because it is, quote, no longer fun, unquote, anymore. So here's the example, ideal situation, stationary platform diver with a descending line, the middle moving platform, and a heavy equipment divan such as hard hat diving. That was me exiting the water during submarine school. Increasing strength, increasing mobility as you move to the right. The older age diver should select non-diving exercise activities that help maintain joint flexibility and muscle strength, as well as cardio activities. The older diver will probably not stop diving when it's too hard to do. Will probably stop diving when it's too hard to do and or is no longer fun. And mobility and strength largely determine this, as I said before. So let's conclude. Older age is not a contraindication for recreational scuba diving. That's my opinion. Physiological rather than chronological age is the important consideration. When making decisions for older persons to scuba dive, the domains of fitness, comorbidities, and mobility strength must all be considered. As a person ages, these considerations become increasingly important. And finally, with increased judgment and reasoning ability from diving experience, appropriate selection of diving sites, older age itself is not a contraindication for diving. And when an older diver plans to initiate or resume scuba diving activities after a prolonged hiatus, the healthcare provider should thoroughly screen for comorbidities and assess the patient's fitness. So I have some questions, but I don't know about the time at this point. I did that in 12 minutes. Okay. What are some fitness conditioning measures? That's pretty straightforward. Yeah, bicycle. Incidentally, in this hotel, they have one of the most magnificent fitness centers that I've been in any hotel facility. And if you do get the opportunity, you should take advantage of that. Stationary bicycles. There is the horizontal bicycles, so if you've had joint pains, arthritis, you're not loading those joints as much. Treadmills, etc. Bicycle riding. Swimming is good. Is scuba diving good for fitness? What's the answer, Nick? Not really if you're doing it right, because you should minimize all those stresses and strains to make your time in the water as low energy demands as possible. So when people say that they want to learn to scuba dive so they'll lose weight, probably not a reasonable decision. Okay, what factors determine when a diver decides to stop diving? Well, we talked about those. Probably when it no longer becomes fun.